Hi, my name is Dr. Jeannine Wright. I am a doctor of holistic health, trichologist, master herbalist, cosmetologist, and I am going to discuss with you stage 2 hair loss. We talked about recently stage 1 hair loss and what that looks like, and I'd like to discuss what stage 2 looks like and what you can look out for. So let's get started. So what you're going to notice with stage 2 hair loss, no matter what age you are, is that you're going to notice more thinning and recession of the hairline. You're going to notice more thinning in the top of the crown, and you're going to notice more overall thinning. So what we typically call that is diffuse hair loss. So you're going to notice more diffuse hair loss in stage 2. Also, during stage 2, you're going to notice more of the medical term, which is alopecia, but which is referred to as balding. So you're going to actually notice some balding. You're going to notice perhaps if you're a man, balding in the top of the head. You're going to start to see more of your scalp, and you're going to start to see more of your scalp through here as a woman. So up through this area, you're going to start to notice more hair loss, and you're going to also start to notice more hair loss through here. So if you like to wear your hair in a bang as a woman, you're going to notice that you've got more of this receding going on through here, and that when you go to comb your hair over to one side or the other, you don't get the fullness, or that the bang isn't laying across as nice as you like, because there isn't enough density there to support that look. So when it comes to treating stage 2 hair loss, typically you'll be discussing with your dermatologist, your regular physician. Typically they're the ones who may refer you to a dermatologist. And also if you're seeking out a trichologist, you may be looking at using a topical. This could be like a minoxidil. Minoxidil also, the other fancy name for minoxidil would be Rogaine. So a lot of people are familiar with Rogaine. Typically women would use 5%, men would use a 10%. Also, what's been going on lately is that people have been being prescribed a oral version of the minoxidil as well, a 5 or a 10%. So that may be an option that is recommended to you. Another thing is the finasteride. That is also an oral prescription drug, usually also known as Propecia, that's been recommended for men. This isn't something that women would ever take. There are some other things that may be recommended on the medical end that your dermatologist, this is a service that your dermatologist could perform for you. This would be a PRP, which is a platelet-rich plasma treatment. When they do this treatment, your blood is extracted and spun out, and then the plasma from that is re-injected back into the scalp. And this works really well to rebuild the follicle and to get that hair growing. I've had a few clients who have opted for this service in addition to getting some other trichology services to maintain hair growth, and they have had excellent results. So this is one of the things that you can do in combination with some other things that are anti-inflammatory in nature that can help regain hair. And this is something that can be done for men or women who are going through stage 2 hair loss. Also, laser therapy is another. I discussed that in a couple of videos back, that low-level light therapy, laser therapy is a great therapy for stage 2 hair loss, in addition to some of the other recommended things that may come from your doctor, or some of the other holistic approaches that you can look at. Laser therapy is more of a holistic approach that, in addition to diet, can help depending on the circumstances of the hair loss. So another thing that can help to reduce additional loss during stage 2 hair loss is lifestyle, managing lifestyle practices, managing your stress levels, making sure you get your rest, making sure you really just take care of yourself, and making sure you're doing the things that you need to do. Because a lot of times, some of my clients, they're dealing with stage 2 hair loss, and we're managing and maintaining their hair growth. But sometimes, I'll get clients, they're like, well, I want to do this, or I want to do that to my hair. And, they're getting some new nice hairs coming in, and they want to tear them right back out as soon as they come in because they want to do some crazy style. So it's really nice and it's really good that you consider where you are in the stage of hair loss, and that you take care of your hair accordingly, and that you do what you're told, and that you take your supplementation when you should, and that if you're using a topical, that you use that topical until you get that hair growing in and getting that hair as healthy as you can. Also, just make sure that if you think you're experiencing stage 2 hair loss, because sometimes people will kind of float through stage 1, not realizing that they've lost hair, because statistics say that before you even notice that you've lost hair, you've lost 50% of your density, which is crazy, right? But it's true, because I've gotten clients in and they've lost so much of their hair, it's unbelievable. And especially with a lot of the different lifestyle changes as far as diets, a lot of people are finding themselves in stage 2 hair loss in the blink of an eye, because they hadn't realized that they were losing hair because they were so highly focused on maybe losing weight at the time, managing a weight loss program, going here, going there, doing some different things, and just kind of looked up one day and saw that 50% of their hair was gone, that their ponytail wasn't as full as it used to be, and that their hairline all of a sudden was further back than they thought it was. And sometimes this happens with them looking at photos, or all of a sudden they happen to look around and they're seeing hair on the floor, in the drain. So just know that if you find yourself in stage 2 hair loss, make sure you contact your primary care physician, and make sure you get to a dermatologist and also a trichologist, because the trichologist can help with assessing percentage of hair loss. They can also help with looking at the terrain of the scalp to see what's going on with that follicle, because if there's simply a miniaturizing of the follicle, or like what's going on, because there's many different things that could be responsible for stage 2 hair loss, such as scarring. It could be a lot of different things. There could be autoimmune issues involved. So you always want to get checked if you are experiencing excessive hair loss that is not your typical hair loss due to a seasonal change in the weather, which makes sense, which is normal and natural. Usually the hair will straighten itself back out, no pun intended, but will straighten itself back out and get back onto a healthier growth, on a healthier growing track. And, so if you're ever losing hair and you're noticing it's excessive, definitely be sure to get to your doctor, get some blood work. Always remember, health is beauty and beauty is health. Don't forget to subscribe. Don't forget to hit the like button. And please don't forget to share. And stay tuned for stage 3 hair loss.